Yeah, I'm gonna do first.
You want to open up?
Did I get out of the shot again? Good evening. I would like to thank everyone for joining us in this recording today as we engage in a discussion regarding COVID-19. I do not believe any true discussion can be had without some learning, sharing of information, thoughts, ideas, and showing appreciation for someone's position related to the subject matter. Meaning, everyone will have an opinion about COVID. And we want to hear it respectfully. But there is only one truth, and that's our pursuit today. Let's take care of some housekeeping items before we jump into the discussion. This presentation is being hosted by St. Timothy Missionary Baptist Church of Cleveland, Ohio. I am proud that the body of Christ has thrown its hat in the ring to ensure the community has access to relevant information and even scientific information. This is a faith-based initiative with underwriting by the Ohio Department of Mental Health and Addiction Services. By way of introduction, I am Jeffrey Sims. I am a psychiatric nurse practitioner specializing in adult psychiatry with services to those who are addicted as well. I have with me at my far right, Cheryl Billingsley, a registered nurse. She actually served as a physician assistant some time ago. And also, to my immediate right is April Holloway, a respiratory therapist. We serve as a clinical consulting group for the Ascension Group, an LLC of Cleveland, Ohio. So I believe we have completed all the preliminary steps. So let's get down to discussion. COVID. This is a broad-based discussion, and during our exchange today, we hope to touch on the most common community concerns and questions. We plan on reviewing relevant CDC updates and talk about common sense practices to keep you, your family, and your loved ones safe. Toward the end, we want to engage in a robust dialogue between me and my two other esteemed colleagues who will lend their clinical expertise to the cause. We will further these types of discussions during upcoming webinars, Zoom meetings, person-to-person, and community encounters. Let us get started. We have a lot of ground to cover in a short period of time. So let's start with, how did COVID get into the United States? And more importantly, directly into our community. Now, if you've been watching the news, nationally and locally, there's been a lot of airtime given to that. There are a lot of theories floating out there. Here are two theories that I think have come to the surface. Where did COVID originate? Granted, there have been no definitive answers, and at this time, I'm not sure that should be our primary focus. We have a lot of vaccines, at least 3 of them, and we have evolved in our treatment. So why give airtime to the origin of COVID? Anyway, I digress. Our two theories. Theory number 1, transmission to the human via intermediary host. The most likely scenario in the spread of the novel coronavirus, according to the WHO. There was an infected animal which transmitted the virus to another animal, which then passed it on to a human being. The infected human being, unbeknownst to them, spread the virus through person-to-person encounter, which led to the pandemic. That's theory number 1. Theory number 2 is spillover from infected animal. The second most likely theory that caused the spread of the coronavirus via animal spillover to humans. According to this theory, the coronavirus was transmitted from an animal to a human being directly without any animal acting as an intermediary. The virus then continued spreading due to person-to-person encounter and super spreading events. So, in its simplest terms, theory number 1, the example, a bat bit a bird and the bird infected the human. Theory number 1. Theory number 2, in its simplest term, a bat became infected and infected the human being without a second animal being involved. So, regardless of how COVID reached us, I would like to point out one important thing. This is not the first time that we have encountered viruses that even have gotten out of control. Granted, this is on a larger scale, a pandemic, but we got through it. Do you remember our past bouts with viruses, virus scares? What about the avian flu? Do you all remember that?
Yeah, the bird flu.
That's exactly right, the bird flu. It happened, I think, around March of 2017. The USDA confirmed highly pathogenic avian influenza, or the bird flu. I'm not going to pick on low-hanging fruit, but they told our community we needed to avoid chicken, we needed to avoid sick poultry. They said, stay away from live birds. And then they said, stay away from dead birds. So I remember going downtown and seeing people run from pigeons, covering their head and running, in all directions. People then took to the excessive issue of washing their hands with bleach and washing their food stations and where they prepared their meals. I recall going into a friend's home and I became intoxicated with all the bleach smell. I had to go outside and get my bearings. So what happened there? The CDC studied the disease, created a vaccine. And when is the last time you heard about that virus? I think of one more. What about swine flu in 2009? It lasted about 19 months, I think from January of 2009 to August of 2010. And with that particular virus, they had deaths. Around 18,449, I think, was reported to the WHO. It did not hit a certain segment like this pandemic. It didn't target the elderly or the geriatric population, nor did it have the same kind of impact on the respiratory system with a lot of pneumonia. But it still packed a wallop. Again, the CDC studied the disease, made a vaccine, and it does not dominate the news like the pandemic. What am I saying? I guess the lessons learned. First, with this pandemic and with the other two viruses, the lessons learned. We should not panic. We should be vigilant, and we must be aware. And some of the common safety practices we engaged in, both with the pandemic and the past two viruses, should become part of our daily practice. Washing our hands, using hand sanitizer when you don't have access to soap and water. But I gotta say, there's nothing that can beat plain old good soap and water. And then cover your mouth when you sneeze or cough. More importantly, keep yourself educated about CDC guidelines. Don't overdo it. You don't have to put on a spacesuit or use a hazmat suit. You know, I got to tell this story. I have a friend, and that when the pandemic first came about, she would go to the grocery store, and then she would buy her groceries and sit it on the back deck. And then she would take out one item at a time, walk in the house, wash that item, and put it either in the cabinet or the refrigerator. And so I watched her go through this process, and she said, "You don't do this? You don't take the same kind of action?" And I said, "Well, no, I don't do that. And by the way, I see a raccoon that just stole your tomatoes and they're running down the street. I'm quite sure they didn't pay for it." So I think you get the picture. Don't overdo it. No overkill. So before we move forward, I want to remind people that COVID is still out there. And we need to remain aware and we need to remain vigilant. Here are some of the acute COVID symptoms. They may appear 2 to 14 days after exposure to the virus. People with these symptoms may or may not have COVID, but this should be acknowledged and acted on. 1, fever or chills. 2, excessive coughing. 3, shortness of breath or difficulty breathing. 4, fatigue. You feel really tired. 5, muscle or body aches. 6, persistent headaches. 7, a new loss of taste or smell. 8, sore throat. 9, congestion or runny nose. 10, nausea or vomiting. And 11, diarrhea. Again, this is not an all-inclusive list of symptoms, but please be aware if you suffer from these symptoms. Now, we talked about acute COVID symptoms. We're going to turn to chronic symptoms of COVID. And April's going to introduce a new term in your lexicon, in your vocabulary. April?
Thanks. Now, what I've seen in my practice are some common long-term symptoms of COVID-19, which affects a large portion of patients who have recovered from the acute disease. Those with the lingering symptoms we call long haulers. Many of these patients are still experiencing symptoms such as brain fog, cognitive impairment, fatigue, anxiety, depression, and headaches. While working in the pulmonary clinic, I have seen these lingering symptoms in some patients who come in to be assessed for their pulmonary issues. Many of them still have the shortness of breath and the difficulty breathing, and require long-term oxygen therapy, even after being discharged from the hospital. These symptoms can sometimes last for weeks to months, and this is due to the significant lung damage that has occurred from the disease. I want to point out to you that the long haulers' symptoms can also be experienced by those individuals who were asymptomatic or did not have the COVID symptoms when they were infected with the virus. That is something that the CDC has found out as well. For sure, the pandemic itself has brought a lot of challenges to the patient's life, both financially and personally. And add to that the long process of recuperating from an illness like COVID, it weighs a lot on you. Now, the issue that we have not addressed fully is the mental health symptoms that are emerging from this pandemic, such as trauma and stress. But we will address that more in our discussion phase. Let us move now to testing. Cheryl?
Thank you. I know that many remain reluctant to complete COVID testing. They believe that it's not necessary now. I want to help you alleviate fear and combat misinformation regarding COVID testing. I'm going to speak briefly regarding the different tests. Again, not all inclusive, but the ones that are commonly used. Antigen testing is the gold standard. Antigen testing is rapid and inexpensive. You may get the results in about 20 minutes. This test will detect the current viral infection. There is about a 20% chance of false negative. If you test negative but you're still sick and very symptomatic, then you can retest and you may find COVID that time. There are also some false positives. Sometimes you may have a different virus, not COVID, and that may make you have a false positive. Antigen tests are mainly taken via the nasal swab. Occasionally they may use saliva, but that's rare. There is the molecular point of care test. That is an antigen test. It is highly sensitive. You only need a small amount of medium, but it is close to 100% accurate. Now there's a different test, the antibody test. This doesn't tell if you currently have the virus, but it tells if you've had it in the past. Say you had flu a couple months ago and you don't know if that was really the virus, coronavirus. You take the test and that may tell you that was really the coronavirus. You had COVID. So that's an instance where that can come in to play. Now you say, why should I get tested? Well, there are numerous reasons. Perhaps you've been in close contact with someone who has been diagnosed with COVID, or you've been in a situation where you're at high risk of viral transmission, such as large gatherings of people, or you've been traveling, or you live or work in an environment like a prison, nursing home, or homeless shelter where there is an elevated risk of viral spread, or there are large cases of COVID, especially in nursing homes and jails. Or you're going to have a medical procedure like surgery or a diagnostic procedure where they want to make sure that you're good to go and you can have that procedure. Sometimes if you're going to start taking a certain medication that might affect your immune system, they want to make sure that you're cleared to take the medication, and they will test you to make sure you're good to go. Then if you're pre-employment, they will do a test to make sure that you're clean so that you can start working or going to school, and they'll require you to be tested. There's another test. These are home test kits, and they're self-explanatory. These are done at home. Sometimes they'll do the swab at home. You can take it to the lab and they can process it there. Or you can do the swab at home and process it at home yourself. Now, there are kits that you purchase, or you can get free kits. And these can be obtained at various libraries or community centers. These tests can be used online with an app and a preceptor who is active in the testing process for verification purposes. He'll go through the testing with you, and you can download the app and it'll show whether you were negative or positive. Home tests contain instructions and equipment, but you can find the instructions on YouTube if yours are missing. Free tests are distributed at various library sites, and the ones that I've seen distribute this are Cleveland Heights Main Library, East Cleveland Library, and Shaker Heights Library. Now, any positive test results are reported to the state and local health departments for tracking purposes. Testing sites can be found at coronavirus.ohio.gov. Test sites change and are sometimes combined with vaccine sites. Now, there are no out-of-pocket costs for testing, but you may be required to show your insurance card or Medicaid card. You may Google free COVID tests to find distribution sites for the free home kits. Most local pharmacies have taken on the task of testing and administering the vaccines. COVID testing sites should be determined by the reason for testing. Say, if the patient is symptomatic or preoperative, then the testing should be done at an urgent care or medical care facility or an occupational health facility. If the test is for employment or school, then you can go to a pharmacy or an occ health site. Again, let me stress, COVID testing can be done as at the pharmacy you walk in or you drive through CVS pharmacy, Walgreens or another pharmacy. Each store varies on whether they want you to make an appointment or not. You have to call. And there are various community centers and pop-up sites. They'll advertise when they're going to be testing, so you can look for that. You should call ahead and confirm the availability of testing. So, can I encourage you to stop struggling with testing? I've been tested a couple times myself. I believe that knowledge is power. Now let's talk about step 2. Jeff, vaccines.
Okay, so first, I want to identify the vaccines that are available to us in Ohio. The Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. I know that there's been a new wave of misinformation, and it has resurfaced again regarding vaccine. And guess what, guys? It happened in Ohio. Ohio, once again, is in the eye of the storm. We will spend a considerable amount of time in our discussion phase regarding vaccines, but may I respectfully ask you to give your ear to science, experts, and lean on your own medical professionals, such as your doctor, nurse practitioner, nurse, or respiratory therapist, pharmacist. And then, even after listening to them, you still are not convinced, then I encourage you to do your own research. Check legitimate sites to get information about vaccines. But one thing I want to stress, how about less emotions, less feelings, more knowledge? Let knowledge direct you to your decision. All right, the vaccines. So the Pfizer vaccine, the first one. Research results show a 95% efficacy for this vaccine out the gate. It's effective at preventing infection in those without prior infections. This is a 2-injection vaccine. The second dose should be administered 21 days after the first dose. You won't be fully protected unless you get both doses. The Moderna vaccine, it's 94.1% effective at preventing symptomatic infection in those with no previous infection. This again is a 2-injection vaccine. The second dose should be administered 28 days after the first dose. You won't get the full protection unless you get both doses. The Johnson & Johnson. This vaccine is 86% effective in clinical trials at preventing laboratory-confirmed COVID-19 illness in people who had no evidence of prior infection. Again, 2 weeks after receiving this vaccine, you are fully protected. This is the only one injection vaccine. This also is a vaccine that has had the most controversy of the three. I believe it was like April the 23rd, 2021, experts started reviewing the safety reports for the vaccine, and they found that 15 women who received the Johnson & Johnson vaccine later developed thrombosis, or what they call blood clots. The reports reviewed all occurred in women between the ages of 18 and 49, with a median age range of 37. These reports represent a reporting rate of 7 such events per 1 million vaccines among women 18 through 49 years old. I'm going to go back over that because there's importance to what I just said. 7 events out of 1 million people who were vaccinated, and it only happened in women between the ages of 18 and 49. So the point I'm trying to drive home, it's a minuscule amount of individuals who had this type of side effect. I'm not minimizing the blood clots.
Right.
They're very important. They were dangerous. Mm-hmm. But again, it was such a small amount. So one other point I wanted to bring up, April, you were talking about long hauler symptoms. And what I recall from research, that the vaccines actually have a positive impact on people who have had long haulers symptoms. Mm-hmm. So it's 2 things I want to point out. One, even though you might have contracted COVID,
right,
we still encourage you to have the vaccine.
Right, that's right.
And then the second piece, that people who had long hauler symptoms, some of them got better. Mm-hmm. Their symptoms diminished, or they dissipated. So the vaccine still is very important, even with those who have had long haulers. So research is still being done in that area, though, by the way.
Definitely.
And they're still kind of garnering information. But in the spirit of transparency, I want to say something about the vaccines. There were side effects. So common side effects for those who had the vaccine. One, pain at the injection site. I'm not a big fan of pain, but I had it. I actually had the Moderna, and the first injection was fine, but the second one, I had pain at the injection site. You had it as well? You had
I had a Pfizer, and yeah, my arm did hurt the first time and the second time.
Okay. So it's different with each individual. Mm-hmm. So a side effect then is pain at the injection site, redness, and some swelling. Throughout the rest of your body, tiredness. I know after I had the second vaccine, I slept a solid 3 hours, steady. I mean, real deep sleep. Mm-hmm. Did you have any symptoms after your injection?
Well, I had the muscle pain. Of course, I didn't know that it was from the vaccine until after, it lasted all day. Usually. Mm-hmm.
So throughout the rest of your body, you can have tiredness, headache, muscle pain, chills, fever, and nausea. Mm-hmm. So these side effects may or usually occur within a day or two after getting the vaccine. It might feel like flu-like symptoms, and it might even impact your ability to carry out day-to-day activities, but you should go through with the vaccine anyway. And one word I would like to say, transient. These side effects go away. They don't last forever. It's 1 or 2 days. Another point I want to bring up about the vaccine, I want to stress for those who are homebound. Some people, because of being medically compromised, are not able to get out of their home. So Cleveland and Cuyahoga County are partnering with local entities to vaccinate homebound individuals. So I think that's great. They just need to call the Western Reserve Area Agency on Aging. I'm going to say that again. The Western Reserve Area Agency on Aging. And they will do screenings and determine if a person is eligible for that service at their home. The referrals will be made by that agency, the Western Reserve Area Agency on Aging, and you can call 216-621-0303. I called to make sure that number was working. Again, that's 216-621-0303. So let's begin wrapping this up, this section on vaccine, by some simple take-home messages. One, in general, people are considered fully vaccinated 2 weeks after the second dose in a 2-dose series, such as Pfizer or Moderna. Also, 2 weeks after a single dose vaccine with Johnson & Johnson, they're fully vaccinated. Now, one piece of misinformation I would like to debunk immediately, and it's an issue related to the vaccine itself. I would be remiss if I didn't address it. When you are receiving the vaccine, that's Moderna, Pfizer, or Johnson & Johnson, you are not receiving live COVID into your body. Rather, it's more of a code or a sequence. It's called an mRNA messenger. What is that? An mRNA vaccine is a new type of vaccine. Really, it's not that new, but it protects against infectious disease. mRNA vaccines teach our cells how to make a protein or a piece of a protein that triggers an immune response or antibodies in our bodies. These antibodies then protect us from future infections. So this mRNA vaccine teaches our body how to fight. It's like the WBCs.
Yeah, white blood cells.
Yeah. It teaches our body, hey, mount an attack, fight against this stuff. Again, the more we educate, the more successful we are at destroying this vaccine hesitancy for the United States and, more importantly, for our own community. Now, what is in the future for vaccines? I know there's been a lot of activity around having adults become vaccinated to get our society reopened. Now there's focus on our children. Mm-hmm. And our children are, it's a very sensitive topic. Mm-hmm. Mainly our children ages 12 and up. Early research is promising, meaning our young children are responding positively to vaccines. However, in the spirit of transparency, once again with the children, you will hear a small segment of our children are having a side effect. It's a heart inflammation or tissue inflammation, usually between the ages of 16 and 24. The reason this first came to my attention I'm a big football fan, and I heard the NFL talking about this, especially with individuals, our new individuals who were drafted. They're between that age of, 20 and 24. And again, this side effect, although there have been millions who have been vaccinated, it's only attacking a small segment. I think around 200 people. So again, we want to be aware of that. No one has died, to my knowledge, related to this inflammation. And again, I'm going to use that word transient, meaning it will go away. And the final statement is, with these vaccines, the benefit outweighs the risk. I'm going to say it again for the vaccines. The benefits outweigh the risk. Keep an eye on this, and I will share more information and truth as it comes out to me. So now we're going to pivot away from vaccines, and we're going to talk about updates by CDC. So CDC stands for the Center for Disease Control and Prevention. And here are some of the updates for the people who are fully vaccinated. Fully vaccinated people can resume activities they've engaged in before the pandemic. You can go outside, you can walk, exercise, travel. But then there's a fly in the ointment. Now, listen to this information. Some call it conflicting information. I call it cautionary information. So we said you can continue with activities that you did before the pandemic. But now, let's hear this. Fully vaccinated people can resume activities without mask or physical distancing, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace guidance. Now it really gets sticky. We need to know, we must know what's going on locally at our businesses or what the state says about the requirements. Let me review something as simple as travel. Let's narrow the focus. Just travel. Fully vaccinated people can travel within the United States and do not need COVID-19 testing or post-travel self-quarantine if they continue to take COVID-19 precautions while traveling, such as wearing a mask, avoiding crowds, social distancing, and washing your hands frequently. Yay. Before we were not getting on planes, we were afraid to get on planes, and now they're saying, hey, you can get on planes and you don't need to have COVID testing. So that's within the United States. Let's move a little bit further. Fully vaccinated people can travel internationally without getting a COVID-19 test before travel, unless it is required by the international destination. So, say for instance, I'm in Ohio. I want to go to Barcelona, Spain, which I do want to go back there. If Barcelona requires that I am tested before I enter their region, I have to get a COVID test. Let's move a little further. Fully vaccinated people must still have a negative COVID-19 test result before they board a flight to the U.S. and get a COVID-19 test 3 to 5 days after returning from international travel. So now I'm in Barcelona. Before I leave Barcelona, I need to be tested. When I get back to Ohio, I need to be tested in 3 to 5 days. Also, fully vaccinated people should continue to take COVID-19 precautions while traveling abroad internationally. So when I'm in Barcelona, I still need to wear my mask. I still need to keep some social distance. I still need to wash my hands. The reason I bring this complicated case up is to kind of stress we are getting back to normal, but it might be a new normal. And although we're not there yet, the door is opening a little bit. And we must stay connected and mindful and knowledgeable about updates, guidelines, and what's going on in our other regions, in our own region. Let's move away from the CDC and talk about Ohio. So on June the 2nd, Ohio lifted their mask mandate and the social distancing requirement for those who are fully vaccinated. However, let me just tell you, I went into a store the other day and the store person turned me around and said, "Where's your mask?" And I'm like, "I'm vaccinated." They said, "Thank you. Can you go outside and get your mask?" I said, "Okay, thank you. I will go outside and get my mask." So again, even though we're talking about locally, abroad, and then in our our own community, there are certain requirements. So we need to keep ourselves updated on these things. If you are unvaccinated or partially vaccinated, so that means that you had injection 1 of the Pfizer or injection 1 of the Moderna, here are some tips and ways to slow the spread. Those unvaccinated and partially vaccinated, wear a mask that covers your nose and your mouth. I can't tell you how many times individuals, I've seen it around their chin, around their neck, but it doesn't work unless it's covering both your nose and your mouth. Stay 6 feet apart from others who do not live with you. I'm going to put a plug in here. Get the COVID vaccine when it's available to you. Avoid crowds and poorly ventilated indoor spaces. And wash your hands with what? Soap and water. Use hand sanitizer if soap and water are not available. Now let's get to the good stuff. I want to hear from you all about some questions that we received prior to coming here, and we're going to have a dialogue. How about if I open it, because I have a hot topic, a hot piece of cornbread right out of the oven. What about the controversy surrounding vaccines? I know we just went on this, for a couple of minutes, but what I saw on the news a couple of days ago that an individual, I think it was from Columbus, Ohio, they were giving their testimony, and they indicated that people who were vaccinated, somehow that with the vaccination, they also put a magnet inside of their body, and now that person was magnetized, meaning I saw them take a spoon and put it to their chest, and it actually stuck on their chest. And so they're saying, hey, what they're really giving you is a magnet in your body. And I just thought that was unbelievable. Did you all see that?
Yeah. Mm-hmm. Yeah.
And I also saw, that an individual had a car key, and they actually put it on their arm and it stuck. And I was like, I can't believe this. These things are being, again, the misinformation. I'm not saying that they were lying, but I am saying that kind of information is misinformation. It doesn't help with the vaccine hesitancy that we see in our community, especially in the African American community.
That's true. You really should educate yourself and search the backgrounds of people who are giving this false information to see if they belong to any.
Legitimate.
Yes,
Yeah, legitimate,
indeed,
yeah.
indeed.
Yeah,
Mhm.
and that's a great point, April. Educate yourself, and again, as I said before, if you're unsure or you're not aware or you're confused by the information, talk to people that you trust, such as your doctor, your nurse practitioner, your nurse, a respiratory therapist. Hey, I talk to my pharmacist when I'm concerned about medication and vaccines or medications. I ask them, can you tell me what you think about this vaccine or this medication? And one point I really want to stress, especially related to this point, a loud and angry person does not always equate to a person that's right. It just means that they're loud and that they're angry. And I think with these type of discussions, what we're seeing a lot of people with a lot of emotion surrounding these kind of things. And the louder they get, the more angry they get, they seem to be getting more followers. And I'm concerned about that.
Mm-hmm.
So knowledge, as you said, Cheryl, knowledge is power. So what do you have, April?
Well, so now, what do you think we do as society to manage our trauma this post-pandemic? We are seeing a rise in violence, anger, and aggression. And I think it is because people are feeling vulnerable and feeling that they have no control over their life. So therefore, they acted out violently.
You know, you're right. I mean, here's what I saw. I was just looking at data. Let's just talk about airlines only. Last week I was looking at the data, and they were saying that there were like 2,900 aggressive acts in the air. So you're 20,000, 30,000 feet, and then people are kind of acting out. Of those 2,900 violent acts, 2,200 were surrounding masks. They were getting angry over masks, both verbally and physically. Mm-hmm. And I was like, oh my God. And I mean, you've seen yourself where I think a stewardess had some teeth removed from her mouth because someone became angry because of her trying to tell them,
put on your mask.
Put on your mask.
Mm-hmm.
And then unfortunately I was watching the news, and I saw this vigil for this young lady in Georgia. Did you all hear about that? She was at a supermarket.
Oh, the cashier.
Yeah, and she was. She told a person to, put on their mask, and the person got angry, and they shot her and they killed her. And I heard the family's, statement about it, and it was just unbelievable. So, I agree. There's trauma. There's a lot of emotional upheaval, and people are really kind of losing sight. You know what I think I'm seeing is a lack of compassion in society. Cheryl, you were telling me about an event where you were on the plane and you had something very similar, that you witnessed something very similar.
Right. The man in front of me, apparently he wasn't wearing his mask correctly according to the lady on the other side. I guess she was trying to give him signals to put his mask on correctly, and he wasn't doing it. So as she was getting up to deplane, she got in his face and told him off that he wasn't wearing it correctly, and she cussed at him and everything, and she was angry, and she was she was violating the 6 foot rule by being up in his face.
To tell him don't put your
She
mask
was,
on.
yeah, just to tell him that he wasn't wearing it right, and he could have bit her. So, both, yeah, that was
Yeah.
bad.
Yeah.
Yeah, you use this word trauma, and what I see with people that I provide care for, traumatized people have limited perspective, limited insight into their own behavior. Sometimes they can't see past themselves. They can't see the event, and so it's such a narrow perspective, and therefore when they're acting out, they can't see that they're really kind of violating a person's right. So what's the resolution? I think trying to think past yourself. Maybe some of these individuals will need to figure out whether they need more help than just what's going on inside their family. They might need to seek professional help.
Indeed.
Correct.
And then one of the things I felt with the pandemic, it lasted so long. I started to lose hope.
Right.
And so what I started to do with myself and with other people that I provide services for, I call it installation of hope, and trying to instill hope and try to tell individuals, get through the day. You'll get through this event eventually. So,
Well, how do you how do we manage our anxiety as we go forward to a new normal? It'll never be the same.
you're right.
Yeah.
You're right. I remember when the pandemic first came about, and we had the I don't want to call it. We were, I think they called the rule to stay at home, shelter in place, or whatever they called it. How much courage and I would say faith that it took for me to get myself, marshal my resources to just go to the grocery store, because all of the things that you were hearing about the pandemic, it was really kind of rough. And then let me say, as first responders, or we all had to go to work.
Exactly.
And we had to provide service during this pandemic. And each day you were at work, and you were like, hey, is it safe? Am I safe? So there was a lot of anxiety, to get through that. And one thing I'll readily admit, the place where I often, kind of dealt with my anxiety and the things that I struggled with, which is the church, even that was kind of taken away, so to speak. You were no longer in a building, but the only way that you could go to church was online, and that was significant. I mean, you didn't have that kind of that support from other Christians, other people. So that was my struggle there. How did you handle your anxiety, April?
Well, I just leaned on my faith. Really, I did. I had to go to work. I have to work with other people. So that's what I did. Of course, I followed the CDC rules, masking, washing hands, and keeping my distance with possible. But I trust my God. That's all I got to say.
Absolutely, absolutely. Again, knowledge is power. People are, leaning on their faith, talking to their trusted family members, loved ones, friends. But there comes a point when you might need to reach out for some professional help, other resources. And I hope to give you a couple of resources that I think might be helpful for those who are still struggling with anxiety and with trauma. We have the Ohio Care Line. Again, the Ohio Care Line, the number there is 1-800-720-9616, or you can text the crisis text line at 4HOPE to 741741. I'm not a big texter, but there you have that. You also, unfortunately, have the National Suicide Hotline at 1-800-273-18255. Again, the National Suicide Hotline, 1-800-273-8255. There's the Metro Health Behavioral Health Services at 216-778-4428. Then there's Mental Health Services at Recovery Resources, 216-431-4131. We'll share these with you in upcoming seminars and webinars. In closing, I want to once again thank each of you for participating in the community dialogue regarding COVID-19. Hopefully we provided some additional enlightenment and information regarding COVID-19. Once again, thank you, St. Timothy Missionary Baptist Church, the Ohio Department of Mental Health and Addiction Services, and Ascension for selecting us to host this event. I don't know about you, but that hour went very fast, and I look forward to speaking with you again. Thank you.
Thank you.
Thank you.